patellofemoral pain syndrome. The tightness in the muscle, the TFL muscle, pulls the band tighter and that kneecap gets pulled over. And the most common cause of knee pain on planet Earth. Today we're going to be talking about the IT band, the Tensor Fascia Latae, or the TFL muscle. We're going to talk about their relationship to back pain, hip pain, knee pain. All of this is going to be associated with repetitive motions. The IT band and the TFL. So that's these guys right here. We have the TFL muscle here. And the IT band runs the entire length from the pelvis all the way down into the knee. This anatomy here causes problems. The TFL is an actual muscle. Its full name is Tensor Fascia Latae. And the IT band is a very misunderstood tissue in the body. When we talk about IT band, the full name is Iliotibial Band. So ilio refers to the iliacus, which is part of your pelvis, this big wing part of the pelvis right here, and it attaches from there all the way down into the knee or into the tibia. So iliotibial band or tract is another name for it. And it is not a muscle, but it is kind of in between a tendon and a ligament. It behaves like fascia. So we've been looking at kind of the front angle of the IT band where you can see the TFL. And by the way, the TFL is a hip flexor muscle. It's in the front of the hip. When it contracts, it pulls the leg up, just like any other hip flexor. And so we can see that IT band in white, and then we can see that there are other muscles that connect into it. Look at that. The glutes connect into it. And so they have a factor of pulling on this fascia. We can see the glutes, the gluteus maximus and even the gluteus minimus do attach into this IT band. When they contract, they are not only pulling on bone, they're pulling on this fascia, this band of tissue, and it's having an effect on the body, especially the hip and the knee, also the back, because everything is connected. And one of the reasons why I like calling it fascia is this TFL muscle here. If you spell out the full name, it's Tensor Fascia Latae. It tenses fascia. That's its job. Let's get into the problem. I look at the body as a synergistic machine. All the muscles work together. And what tends to happen with us is the muscles get out of balance with each other. When these muscles get out of balance with each other, the muscles in the front pulling on the front of the IT band and the muscles in the back pulling from the back, they get out of balance with each other, they're going to pull on that band in different angles. And the predictable pattern in the body is that the front muscles, the hip flexor muscles, are the ones that get too tight. They're predictably hypertonic. And the muscles in the back, the glutes, are predictably hypotonic. They don't have enough tone in them in a lot of people, and it causes that muscle imbalance problem throughout the entire body. If we're going to zoom in on this one tissue today, that causes the IT band to get pulled forward. If you follow the arrow of my mouse, it's getting pulled more so in that direction, and this becomes extremely relevant when you're talking about the knee, because if this band is getting pulled more in that direction when it attaches into the knee, guess what happens? This tissue attaches directly into the kneecap. And when the kneecap gets pulled out of alignment, out of its groove, we get patellofemoral pain syndrome. You get a tracking disorder in the knee. And the kneecap is tracking a little bit off center. We can look at this image here, and you can see the IT band here coming down, attaching into the kneecap. The tightness in the muscle, the TFL muscle, pulls on this band and pulls the band tighter, and that kneecap gets pulled over in the groove. It gets pulled laterally. Lateral patellar tracking is another word for this knee pain, and the most common cause of knee pain on planet Earth. Another common problem is the hip pain. When it's just getting too tight up high, this band, this IT band, rubs on a bony structure. This is the greater trochanter, and that IT band runs over the top of it. And when it gets pulled tight by this TFL muscle that's right here, it just makes it a little too taut, and it's rubbing on this bony landmark and causing friction and pain. One of the things that I teach about as a strategy that I like to use, using reciprocal inhibition. So we can inhibit a muscle by creating extra tone, more activity in its opposing muscle group. What's on the opposite side of the body of the IT band is the glutes. So if we can get more tone in the glutes, we can inhibit its opposite. It's like a universal law of the body. In order for my bicep to contract, if I want to contract my bicep and bend my arm, the opposite muscle, the tricep, has to relax and it has to let go and lengthen in order to allow for this contraction. And so the body does this as part of its operation of how it functions. And that's true not only for active contraction, but also just tone, the resting tone in a muscle. In contrast to, say, stretching a muscle, this tissue actually does not stretch. We can think of it in this sense. It's kind of made of this similar material as a ligament, and you do not stretch ligaments. It doesn't stretch, and if you try to stretch it, you're potentially going to cause problems. Also, foam rolling is another recommendation people give. Since it's not really a muscle, it doesn't get knots in it. The foam roller rolling on it isn't really going to do much, but what it will do is it's going to roll the muscle underneath the IT band. So if you have rolled your IT band and experienced any kind of effects or results from foam rolling your IT band, it's actually because you're foam rolling this really large muscle underneath it called the vastus lateralis. It's one of the quad muscles. What is the technique that we want to use to strengthen the glutes? You probably already know the bridge is one of the most effective exercises on the planet. If you have IT band pain or hip pain or knee pain only on one side, then it is worth taking a look at your left-right balance in the body. We've talked about that in recent videos. And if you can, start doing a modified or even full single leg bridge. So there's that TFL attaching into the knee, and we're lengthening and inhibiting it while simultaneously strengthening and activating the glutes. And so this exercise, while it's incredibly effective, it may actually reproduce your symptoms. If you already have irritation going on, the IT band also rubs over this lateral epicondyle of the knee right here. It's going to pull that IT band even more taut when you get into the bridge because you're lengthening the TFL, you're lengthening the tissues that tug on it. The modified version of the bridge that I recommend is if this person right here were to get a big exercise ball and put it right here, right in front of where his feet are, he or she can straighten their legs and prop their legs up on the exercise ball. Or it doesn't have to be a ball. It could be a couch or a chair, and you are able to bridge up on straight legs. That's going to be a much more tolerable way to do this exercise while strengthening, activating the glutes, but not so much irritating the problem. IT band pain is often reproduced by going downhill. That is in alignment with IT band syndrome or IT band pain that is rubbing over your greater trochanter in your hip. And it all ties in, it all makes sense to the anatomy, because when we're going downhill, we are using our hip flexors extra heavily. This TFL muscle is having to contract extra heavily when you're going downhill to slow you down so you don't end up running downhill. If you're trying to walk downhill, you're actually slowing yourself down, and you're using your hip flexors to do that. It can create and reproduce IT band pain syndrome. IT band does not get tight, it does not stretch, but the muscles that attach into it, most likely the TFL, is what gets tight. It's important to know that. So we don't stretch the IT band. So say this person were to not completely lift this leg up, but just slightly reduce the amount of weight on it. 25% of the weight is still on this leg, and now 75% of the weight is on this other leg. And you can work your way up by reducing that percentage down to zero eventually over time and being able to do a full single leg bridge. First step is, for me, it's always educating myself on the problem. What is the second step? Second step is going to be finding the floor, getting really comfortable with it, getting down on that floor and letting your body melt into the floor. Start from the center. We got to start with the core. I would back anchor, I would front anchor, and then you progress from there. But when you have a big setback, I was just talking above about going back to the basics. We appreciate you here at Core Balance Training for leaning into your health, and we'll see you again next week.